Kenapa tidak terkirim? Bu Ketua Panitia, jam 1 kita mulai.
Kita menunggu barangkali sekitar 5 menit setelahnya, Pak.
Gimana, Dok?
5 menit, 13 lewat 5 menit boleh ya?
Siap.
Kita masih menunggu ya.
Recording in progress.
Pak Mus.
Mohon izin Prof. Dok, kita mulai kegiatannya. 3, 2, 1.
The Honorable Chancellor of Hasanuddin University and staff, the Honorable Professor Muhammad Ruslin, DDS Master of Health, PhD, Specialist and Consultant in Oral and Maxillofacial Surgery as Dean of Dentistry Faculty of Hasanuddin University. The Honorable Professor Dr. Sabri bin Musa as our speaker today in lecture session. The Honorable Tunde Bampose, BDS, DDS, MS, FM, CDS, FWACS as our speaker today in lecture session. The Honorable host, co-host, and our colleagues in Dentistry Faculty. And the Honorable the audiences entirely. Assalamualaikum warahmatullahi wabarakatuh. Good day, ladies and gentlemen, and welcome on this very special occasion, the 7th International Conference on Biophysical Technology in Dentistry, Icobtd, held by Faculty of Dentistry, Hasanuddin University in collaboration with Universitas Airlangga, Universitas Brawijaya, Universitas Indonesia, Universitas Gadjah Mada, Universitas Sumatera Utara, and Universitas Pajajaran, with the theme Emerging Technologies and Interdisciplinary Research in Daily Dental Practice. Today, on 24th of February 2022, for opening and first session of main lecture. With me today, Rahma is your master of ceremony. And previously, we would like to say thank you for all the sponsors who have supported for the success of this event. Ladies and gentlemen, first of all, let us pray and praise to God, Allah Subhanahu wa Ta'ala, because over the blessings and graces, so we can attend and participate in this special conference today on Biophysical Technology in Dentistry, Icobtd, with the theme Emerging Technologies and Interdisciplinary Research in Daily Dental Practice. Praise and greet to our beloved Prophet Muhammad Sallallahu Alaihi Wasallam, who had brought us to the path of light and left the darkness in this life. Ladies and gentlemen, on this nice occasion, let me deliver the agenda of the event today as follows. The first agenda is opening. The second agenda is singing National Anthem of Indonesia Raya and March of Hasanuddin University. The third agenda is welcoming speech. The fourth agenda is praying. And last but not least, closing of opening ceremony. Ladies and gentlemen, let's begin this event by saying Basmalah. Hopefully, this event that we will hold on this day, it will run without any obstacle at all. Move on to the next agenda is singing National Anthem of Indonesia Raya and March of Hasanuddin University. Please, all audiences would start at the video. Thank you. The next agenda is welcoming speech. The welcoming speech will be delivered by Professor Muhammad Ruslim, DDS Master of Health, PhD, Specialist and Consultant in Oral and Maxillofacial Surgery, as Dean of Faculty of Dentistry, Hasanuddin University. Time and screen are yours.
Thank you very much for the Master of Ceremonial. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. The Honorable, all our international and national speakers. In this time, is special to the Professor Sabri Musa and also to Dr. Tunde Bambose, BDS, DDS, Master Science, PMCDS, PWACS, and also the Honorable all the moderator and the Honorable of the Chief of Committee 7 Icobtd 2022 and all participants Icobtd, ladies and gentlemen. Alhamdulillah Rabbil Alamin, all praise and thanksgiving to Allah Subhanahu wa Ta'ala, good Almighty, so that we all have a chance to participate in this event. It's an honor for me as the Dean, Faculty of Dentistry, Hasanuddin University, welcome you all in the 7th International Conference on Biophysical Technology in Dentistry 2022, with term Emerging Technology in and Interdisciplinary Research in Daily Dental Practice. I am very grateful and we are strong while in making this conference worth and success, even though we can only reach each other in virtually situation. Ladies and gentlemen, as one of the largest educational institutions in eastern part of Indonesia, Dentistry Faculty Hasanuddin University is responsibility not only to educate it and to produce dentists that ready to compete in the community and the international world, but we are also expected to become a motor of quality improvement and competence of dentists. In carrying out their profession, dentists provide excellent dental and oral health services and in accordance with the rapid progress of science in technology in dentistry. I would like to express my gratitude and respect to all our honorable speakers from the international and national who are spending time to share their knowledge and valuable experience with us. To the Rector of Hasanuddin University, on behalf of the Faculty of Dentistry, we express our respect and gratitude for all the support for this event. My heart appreciation also delivered to all the committee for the great teamwork so that this event can run successfully. To all participants, I hope you could have a productive times and interesting and exciting discussion. I sincerely hopeful that this 7 Icobtd 2022 online series will bring a great success, give a new hope and new knowledge, as well beneficial for dentistry, student, dentists, and society. And also, I would like to say thank you very much to our host collaboration in this event in 7 Icobtd International Conference with our host, Faculty of Dentistry, Universitas Erlangga, Faculty of Dentistry, Universitas Brawijaya, Faculty of Dentistry, Universitas Indonesia, Faculty of Dentistry, Universitas Gadjah Mada, and Faculty of Dentistry, Universitas Sumatera Utara, and the last is Faculty of Dentistry, Universitas Pajajaran. Thank you very much for your collaboration and your great team together with us, and we hope we can strengthening our collaboration in the future. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thus, the speech delivered by Dean of Faculty of Dentistry, Hasanuddin University. Thank you, Professor Muhammad Ruslin, for the welcoming speech. The fourth agenda is praying. The prayer will be recited by Fadlil Ulum Ar-Rahman, DDS and Dental Maxillofacial Radiology Specialist. To Fadlil Ulum Ar-Rahman, time and screen are yours.
Thank you very much for the master of the ceremony. Ladies and gentlemen, before we pray together, allow me to lead and deliver our prayer today in the guidance of Islamic religion. Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. Alhamdulillah rabbil alamin. Assalatu wassalamu ala asyrafil anbiya'i wal mursalin. Sayyidina Muhammadin wa ala alihi wa sahbihi ajmain. Dear Allah subhanahu wa ta'ala, thank you for every blessing you have given us today, for every mind and heart that feels the presence of this meeting room. We thank you. Only you really know what we want to achieve today. We have ideas, we have visions, clues, and daily instructions. We have the talent, ability, and time to work. However, only you can see in perfect detail the end of each beginning of everything. Nothing is wasted, even mistakes and missteps are used for good. Our prayer today is that your will be done through this event. Take what we have prepared and multiply our efforts as only you can. Keep us physically safe and guard our hearts and minds from pride and selfishness. Forgive us for when we don't thank you enough, for who you are, for all that you do, for all that you're given. Bless this meeting today, all those present, as well as the lives of those who will encounter afterward. Ready us to make every moment count. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhanaka rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Fadlil Ulum Ar-Rahman DDS, who has been recited the prayer. May Allah always bless us. Amin. Ladies and gentlemen, finally, we get to the last station, that is closing. As the master of ceremony, I would like to thank you to Professor Muhammad Ruslin, as Dean of Faculty of Dentistry, Hasanuddin University, who has opened our event today, and for all the committee and the audiences entirely. Eventually, we would like to inform for all audiences to grab food and drink and stay with their devices, as after this closing, we will have a first session of main lecture today, and one wouldn't like to miss it because today we have a meet with two great speakers and moderators. Ladies and gentlemen, even guiding this event, there were mistakes or often someone here who would like to apologize. I'm Rahma. Have a good day and stay safe. Wassalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, before we enter our main station today, we will share to all of you guys the video of our sponsor by Polydent. Could operator to share the video, please? Thank you.
Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser. Coba sekarang.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi, cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser. Coba sekarang.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance.
Redakan ngilu akibat gigi sensitif dengan Sensodyne Repair and Protect. Ini merupakan terobosan yang bagus untuk para penderita gigi sensitif. Sensodyne Repair and Protect dengan teknologi Novamin akan masuk ke tubulus dentin dan membentuk lapisan mineral pelindung baru di permukaan gigi yang rusak. Sensodyne Repair and Protect adalah solusi untuk orang-orang yang mengalami keluhan gigi sensitif agar bebas nikmati makanan dan minuman panas atau dingin. Saya merekomendasikan Sensodyne Repair and Protect yang inovatif.
Thank you. And we would like to welcome Dean of Dentistry Faculty of Universitas Airlangga. Perhaps the operator could add spotlight for Dean of Dentistry Faculty of Universitas Airlangga. Please, Dean of Universitas Airlangga could say hi for our audiences of Icobtd.
Banyak pikiran untuk majuan kita. Dan terima kasih Bu Ketua. Assalamualaikum informasinya kontribusinya untuk
And next, our Dean of Dentistry Faculty of Universitas Brawijaya. Perhaps the operator could add spotlight to our Dean of Dentistry Faculty of Universitas Brawijaya and say hello to our audiences today. Next, our Dean of Faculty of Dentistry of Universitas Gadjah Mada, Profesor Dr. Gigi Suryono.
Terima kasih. Assalamualaikum warahmatullahi wabarakatuh. Selamat dan sukses ya kami ucapkan kepada Universitas Hasanuddin yang telah menyelenggarakan ya konferensi internasional yang ke-7 di bidang biomateria. Sukses selalu. Terima kasih. Billahi taufik wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for Dr. Gigi Suryono as Dean of Faculty of Dentistry of Universitas Gadjah Mada. And we would like to welcome Dean of Dentistry Faculty of Universitas Indonesia. And we would like to welcome Dean of Dentistry Faculty of Universitas Sumatera Utara. And we welcome our Dean of Dentistry Faculty of Universitas Pajajaran. Those are our co-hosts today in collaboration with this special event, International Conference on Biophysical Technology in Dentistry, Icobtd. And as the committee, we would like to welcome Public Health Organization,
Selamat datang di Fakultas Kedokteran Gigi Universitas Hasanuddin. Fakultas Kedokteran Gigi dimulai sejak tahun 1968. Saat itu terjadi pertemuan antara tim dari TNI Angkatan Laut yang dipimpin oleh Dr. Gigi Lim Jing Kiat bersama dengan Dr. Gigi Halimah dan Sikati. Pada tanggal 8 Juni 1974 ditandatangani perjanjian kerjasama antara kedua institusi Universitas Hasanuddin dengan TNI Angkatan Laut. Departemen Kedokteran Gigi Fakultas Kedokteran Gigi Universitas Hasanuddin kemudian berubah menjadi jurusan Kedokteran Gigi Fakultas Kedokteran Universitas Hasanuddin. Fakultas Kedokteran Gigi dibentuk sejak tahun 1983. Saat itu mengelola satu prodi, yaitu Prodi Pendidikan Dokter Gigi yang terdiri atas tahapan Sarjana Kedokteran Gigi dan tahapan Profesi Dokter Gigi.
IPK untuk pendidikan profesi dokter gigi itu sudah cukup bagus ya. Kami lihat perkembangannya di tahun 2019 itu rata-rata 3,5, ada level 3,0.
Untuk sumber daya manusia, Fkg saat ini mempunyai 21 profesor, 21 lektor kepala, 25 lektor, 16 asisten ahli, 12 NIDK dalam proses pengusulan fungsional. 28 dosen dengan kualifikasi SP2 atau konsultan, 53 dosen spesialis 1, 43 dosen doktor, 17 dosen magister. Beberapa staf dosen saat ini juga sedang menempuh pendidikan di dalam dan luar negeri.
Untuk bidang kemahasiswaan, ada beberapa kegiatan yang dilaksanakan oleh mahasiswa seperti kegiatan seni, kegiatan budaya, kegiatan olahraga, dan ada beberapa di antaranya yang berprestasi. Salah satu yang menjadi unggulan dari kegiatan kemahasiswaan adalah kegiatan program kreativitas mahasiswa. Dari tahun ke tahun terjadi peningkatan baik dari segi proposal, baik dari segi didanai maupun hasil yang didapatkan oleh mahasiswa kita. Untuk kegiatan selanjutnya adalah program mahasiswa wirausaha atau yang disingkat dengan PMW. Program ini mahasiswa diajarkan bagaimana membuat suatu usaha yang dari hasil usaha itu nantinya dapat dijual di masyarakat.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance.
Fakultas Kedokteran Gigi Universitas Hasanuddin secara resmi didirikan berdasarkan keputusan Rektor Universitas Hasanuddin dan keputusan Menteri Pendidikan sejak tahun 1983. Saat ini, peminatan terhadap Fakultas Kedokteran Gigi Universitas Hasanuddin semakin meningkat dari tahun ke tahun melalui jalur reguler dan internasional, sejalan dengan program World Class University. Hingga saat ini, Fakultas Kedokteran Gigi Universitas Hasanuddin telah menghasilkan ribuan alumni yang telah tersebar di seluruh dunia demi meningkatkan ilmu dan keterampilan, mengabdikan diri kepada masyarakat, mulai dari kota hingga ke pelosok negeri. Program studi kedokteran gigi Universitas Hasanuddin telah terakreditasi A untuk tahap sarjana berdasarkan pada keputusan LAM PTKes. Program studi LAM PTKes. Program studi ini ditunjang dengan sarana dan prasarana seperti e-library Fakultas Kedokteran Gigi Universitas Hasanuddin, 33 ruang tutorial, 3 ruang kelas internasional, serta 3 aula. Ruang laboratorium, USC Center, ruang CBT, ruang jurnal dan unit production house, ruang dental education unit, serta bekerja sama dengan Rumah Sakit Gigi dan Mulut Pendidikan dan Rumah Sakit Pendidikan Universitas Hasanuddin. Program studi sarjana kedokteran gigi dan program studi profesi kedokteran gigi memiliki visi sebagai pusat pengembangan ilmu pengetahuan, teknologi, dan riset kedokteran gigi yang bersaing di tingkat nasional dan internasional dalam bidang pendidikan, penelitian, dan pengabdian kepada masyarakat dengan berbasis benua maritim. Misi yang diemban oleh program studi pendidikan dokter gigi, baik tahap sarjana maupun profesi, adalah meningkatkan mutu pembelajaran berbasis kompetensi dengan metode student-centered learning dan menyediakan lingkungan belajar berkualitas untuk pengembangan kapasitas pembelajaran yang inovatif dan proaktif. Menumbuh kembangkan ilmu pengetahuan, teknologi, seni dan riset dalam bidang kedokteran gigi. Menerapkan dan menyebarluaskan ilmu pengetahuan, teknologi dan seni kedokteran, serta tanggap terhadap perubahan dalam rangka meningkatkan derajat kesehatan gigi dan mulut masyarakat. Usaha tersebut dilaksanakan demi mewujudkan tujuan akademis, yaitu untuk menghasilkan dokter gigi yang berkualitas, profesional dan bertanggung jawab, membangun karakter peneliti bagi dosen dan mahasiswa, serta kerjasama keduanya dengan memberikan dukungan maksimal pada setiap keikutsertaannya pada kompetisi karya ilmiah, serta menerapkan dan menyebarluaskan ilmu pengetahuan kedokteran gigi untuk masyarakat.
Fakultas Kedokteran Gigi Universitas Hasanuddin terbentuk sejak tahun 1983 dengan visi sebagai pusat pengembangan insani, ilmu pengetahuan, teknologi, seni dan budaya yang unggul di bidang kedokteran gigi dengan berbasis semangat benua maritim. Kami terus melakukan upaya pengembangan diri, sehingga saat ini Fakultas Kedokteran Gigi Universitas Hasanuddin mempunyai 11 program studi. Program studi tersebut adalah program studi Sarjana Kedokteran Gigi, program studi Profesi Dokter Gigi, program studi Spesialis Konservasi, program studi Spesialis Periodontia, program studi Spesialis Prostodontia, program studi spesialis bedah mulut dan maksilofasial, program studi spesialis ortodonti, program studi spesialis kedokteran gigi anak, program studi spesialis radiologi, program studi magister ilmu kedokteran gigi, dan program sarjana terapi gigi. Sejak tahun 2019, kami menyelenggarakan program kelas internasional untuk program studi pendidikan kedokteran gigi. Dalam penyelenggaraan pendidikan, Fakultas Kedokteran Gigi Universitas Hasanuddin bekerjasama dengan 2 rumah sakit, yakni Rumah Sakit Gigi dan Mulut Pendidikan sebagai rumah sakit utama dan Rumah Sakit Pendidikan Universitas Hasanuddin, serta beberapa rumah sakit sebagai rumah sakit jejaring pendidikan.
Seiring dengan kemajuan ilmu pengetahuan dan teknologi, program pendidikan Dr. Gigi Universitas Hasanuddin terus mengembangkan diri serta menjawab segala tantangan dalam memenuhi kebutuhan sumber daya manusia di bidang kesehatan gigi dan mulut di Indonesia adalah melahirkan lulusan yang berkualitas secara profesional yang mampu memberikan kontribusi konkret demi tercapainya peningkatan mutu kesehatan gigi dan mulut masyarakat di Indonesia. Dan sesuai visi program pendidikan dokter gigi Fakultas Kedokteran Gigi Universitas Hasanuddin yang berstandar internasional menjadi pusat pengembangan ilmu pengetahuan, teknologi, dan riset kedokteran gigi yang mampu bersaing di tingkat nasional dan tingkat internasional dalam bidang pendidikan, penelitian, dan pengabdian kepada masyarakat dengan berbasis benua maritim Indonesia. Untuk menghasilkan dokter gigi yang berkualitas, profesional, dan bertanggung jawab sesuai dengan insan cendekia berkarakter maritim, setiap tahunnya kami selalu berupaya melakukan pembenahan sistem pendidikan dengan mengimplementasikan standar kompetensi dokter gigi Indonesia ke dalam kurikulum yang komprehensif dan bermutu tinggi dengan luaran yang terukur.
Program studi pendidikan dokter gigi terdiri atas 2 tahapan, yakni tahapan akademik dan tahapan profesi. Tahapan profesi merupakan lanjutan dari tahapan akademik. Penerimaan mahasiswa profesi dilakukan pada tiap periode yudisium tahapan akademik. Aktivitas mahasiswa tahapan profesi diawali dengan orientasi penerimaan mahasiswa profesi selama 2 pekan. Selanjutnya, mahasiswa akan menjalani kegiatan tahapan profesi selama 4 semester pada 9 departemen, yakni 8 departemen berbasis klinik di Rumah Sakit Gigi dan Mulut dan 1 departemen berbasis masyarakat. Kompetensi yang harus dicapai oleh mahasiswa profesi sesuai dengan standar kompetensi dokter gigi Indonesia yang dijabarkan dalam kurikulum tahapan profesi dengan penerapannya mengusung program One Visit Departemen. Kegiatan pemberian klinik tahapan profesi dokter gigi didukung oleh kualitas Rumah Sakit Gigi dan Mulut Pendidikan Unhas yang sangat memadai dan terakreditasi paripurna. Penjaminan mutu pada program pendidikan dokter gigi dilakukan secara berkala, meliputi proses monitoring dan evaluasi, yakni menilai proses pendidikan serta fasilitas yang tersedia oleh gugus penjaminan mutu yang dilakukan setiap semester. Mahasiswa yang telah menyelesaikan tahapan rangkaian kegiatan pendidikan akan mengikuti uji kompetensi mahasiswa program profesi dokter gigi.
Bergabung bersama Fakultas Kedokteran Gigi Universitas Hasanuddin, program studi pendidikan dokter gigi demi amal padu mengabdi.
Welcome, Professor Sabri Unhas. Ladies and gentlemen, back with me, and we are going to our session today. At first, we have announcement from committee to all audiences today that we have special door prize by Polydent. Thank you for Polydent, which it will give for best question, and we will announce it at the end of session. So get ready for all audiences and get the prize. And before we move to our main session and welcome our moderator for the first session today, let's see our moderator's profile in advance. As you can see by video on your screen right now. Could the operator to share screen the CV, please? Thank you.
Assalamualaikum.
Waalaikumsalam, Prof. Roslin. Apa khabar? Apa khabar semua? Dr. Ernie dan semua.
Alhamdulillah, Prof. Alhamdulillah.
Saya senang sekali. Yap, Unhas Universiti Hasanuddin selalu dekat di hati saya.
Actually, we all like to you attend to come Makassar, not by online, yeah, offline. But the situation is really bad.
Yeah, and congratulations, Dr. Roslin. Once again, congratulations. Yeah.
So we hope next time, yeah. I hope.
Yeah, maybe next time. Yeah, the situation is not quite good even in Malaysia. Yeah, the
Okay.
cases is going up and up. Yeah.
Thank you very much, yeah, Professor Sabri Musa.
Not at all. You're most welcome.
My vice rector.
Thank you, Prof. Sabri, for joining with us today
Not at
in
all.
the celebration of our Dean Professorship as well. This morning we have a special Senate meeting for our faculty anniversary, Prof.
Right.
So
right.
there's a lot of things to celebrate.
Right. I'm
with
so
our
sorry.
faculty.
Yeah, tomorrow there's some glitch. Would love to join yesterday, but unfortunately, I have some glitch there. Nevertheless, I'm happy to be here today. Yeah.
Perfect, Prof. Perfect. It is a wonderful day for us. So with you joining with us is also an honor for us.
Yep.
Thank you.
No,
And I saw that you can join this event earlier than we supposed to do. Yeah.
Thank you. Without lingering, let's welcome our moderator, Yaya Inaya, DDS and Pediatric Dentistry Specialist. Time and screen are yours.
Thank you, Master of Ceremony, Rahma. Honorable the Dean and Staff of Faculty of Dentistry, Hasanuddin University, all of University as a co-host, all the speakers, especially Prof. Sabri as the first speaker today, our colleagues, ladies and gentlemen, distinguished participants, good afternoon and best regards to all of us. Assalamualaikum warahmatullahi wabarakatuh. For the first, my name is Yaya Inaya, Pediatric Dentistry Specialist, and I would like to thank you to organizing committee to give me the opportunities become a chairperson in the 7th International Conference on Biophysical Technology in Dentistry that held by Faculty of Dentistry Hasanuddin University. As the first session gonna be delivered by Professor Sabri and will presented about pediatric oncology patient in relation to oral health issue. Before we begin his presentation, the organizing committee will show to us our speaker's brief curriculum vitae. So please watch and behave. Okay, ladies and gentlemen, distinguished participants, before we begin the presentation, if you have any question, kindly please fill in the chat box feature below in your monitor, and we'll answer in discussion session directly. There will be door prize for the best question and will be announced in the end of the session. Now, allow me to welcome the speaker to deliver his presentation. Your time is about 45 minutes. Prof. Sabri, the time and screen is yours.
Assalamualaikum warahmatullahi wabarakatuh. Can you see my screen?
Yes, Prof.
Sorry, but let me just put in a presentation mode. Unfortunately, I couldn't see my screen. Hold on, let me just. Just get back. I couldn't see my screen. Let me just get back. Okay, can you all see my screen?
Yes, Prof.
Can you hear me well?
Yes.
All right, thank you very much. I'm sorry for slight glitch there. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone. Near and far, wherever you are. First of all, I would like to sincerely congratulate your Dean, Professor Rusling, for his deserved promotion. And again, also to thank the organizers for inviting me to the professorship inauguration program and also 7th International Conference of Biophysical Technology in Dentistry. And today I would like to share my experience on the title of my presentation, which is a pediatric oncology patient in relation to oral health issues. Okay, I'm being the to Unhas so many times, and it's always my pleasure being invited to deliver my thoughts or share my experience. And for past of my experience, I did lots of works on stem cells as well, and not to forget my area of pediatric dentistry. And for this area of research that I've done, pediatric oncology patient in relation to oral health issues, this is part of interdisciplinary work that be encouraged by the universities and the government of Malaysia, whereby this work consists of 3 sub-programs, which I lead as a whole. And the sub-program 1 is dental approaches for pediatric oncology patients, whereby we look at characteristics of the population treated at the Pediatric Dentistry Clinic, University of Malaya Medical Centers. And also the sub-program 2 is spiritual-based strategy in enhancing parental acceptance for improved quality of life solutions by parents of children with cancer. And we collaborate with the Islamic Studies department. And the third program is the molecular characterization and associated clinical manifestation of opportunistic pathogenic organism among immunocompromised children with cancer. We collaborate with the parasitology department of medical faculties. And of course, sub-program 1 is under dental faculty. And each research group member I highlighted here because I appreciate so much, because when we started the work, there's a lot of things to be done. We got to apply for the grants, and then we got to identify which area, as what we always do when we want to do research work. We have to make sure that all the specialty or relevant person should be included in our team to make sure that smooth running of our work. And these are the my co-workers. Sub-program 2, I have to highlight it's heading by Associate Professor Dr. Zarina Shari, and the sub-program 3 is led by Dr. Romano Ngui. I try to remove part of the, I'll try to remove part of the small icon here that disturb me. Let me just. Okay. Sorry. So the drastic decline in mortality rate of pediatric cancer population due to early diagnosis and improvement in oral oncology treatment happened, and then an important role in the prevention, stabilization, and treatment associated with the oral and dental problems that can compromise the child's health and quality of life. And psychotherapeutic approaches have been used in enhanced parental relationships with their cancer-stricken children. And this all came from all the literature that we have done, and the methods applied so far on psychotherapeutic approaches ignore the concept of spiritual or spirituality. Hence, the religious spiritual-based strategy will be explored in this work, because we found out that's not really embark spiritual and spirituality in the psychotherapeutic approaches normally worldwide. And next, in relation to opportunities pathogen infections, which stand as a second most of death amongst pediatric patients. Also, opportunistic intestinal OPI also may cause persistent diarrhea and severe malabsorptions related to oral infections in oncology patient or child, and opportunistic intestinal parasitic infections and its association clinical data in children with cancer remain unclear. That is why we try to do something, sort out something, and find something to make it clear for our Malaysian data, especially. Yeah. And having do the literature search and related problems that we had, because in the Faculty of Dentistry, University of Malaya, as part of the doctorate program for pediatric dentistry, we send our students to go for a walk round at University Malaya Medical Center in the hospital there, and they try to see what they can do the best in oral health improvement for the oncology patient, especially the child patients over there. And we found out lots of problems initially, and we started this work about 2 years ago. Yeah, and then we found out that some of them are reluctant to cooperate because some of the patients come from away from Kuala Lumpur, being referred by the other states, because of the facilities. I think University Malaya Medical Center is one of the most complete hospital. I think it's actually one of the most complete hospital in Malaysia, with all the specialties, all area is there in one hospital. So our aim is to discuss oral health issues, including the improvement of quality of life associated with spiritual-based strategies and detection of opportunistic parasitic infections and among pediatric oncology patients prior to receiving cancer therapy of treatment. And the research objective of sub-program 1 is to identify characteristics of oral health diseases based on existing pediatric dentistry oncology dental records to determine suitable oral health care and treatment recommendation based on the cancer therapy and treatment, to develop guidelines to referral to pediatric dentists for oral health assessment and continuation of oral care, and to determine the perception on the importance of oral health among the parents and children with cancer. So far, before we did this study, although we go to do walk rounds or whatever, when the patient first diagnosed with the oral cancer, they are not referred to us pediatric dentists as a routine. So some of them come with a severe oral hygiene problems, which may compromise their quality of life. More so, while during the treatment, the situation become worse, because we know what therapy did to the oral hygiene, as a side effect. So we try to tackle those problems to make sure they are referred as early as first day they diagnosed with oral cancer to us, to make sure that oral hygiene is well taken care of. And for research objective of sub-program 2, under looking at psychotherapy or psychospiritual aspect, we try to identify the psychological problems among parents and children with cancer to produce a holistic approach for cancer rehabilitation based on Islamic psychospiritual and psychotherapy knowledge, and to determine the effectiveness of the module therapy psychospiritual Islam among Muslim and non-Muslim parents. And research objective for sub-program 3 is to determine the occurrence of opportunistic pathogen bacteria in children with cancer, to determine the occurrence of opportunistic intestinal parasitic infection in children with cancer, to differentiate the specific species of the opportunistic pathogen organism, to characterize the genetic makeup of the opportunistic pathogenic organism, to determine the association between the opportunistic pathogenic organism and their clinical manifestation. When run simultaneously, and we're using the patient that was treated at our oncology ward in University Malaya Medical Centers. And throughout the procedure, we facing a lots of problems, such as commitment, cooperativeness from the patient and the parents, because they had enough already, with the situation, and sometimes we go there to get some sample, asking the question, giving the questionnaires, and even to take the stool for parasitology teams from the patients. Some are reluctant to give the cooperatives, but at the end we managed to get the ample samples, that make us able to report and publish. And the findings of sub-program 1, the identification of characteristics of the oral diseases affecting pediatric oncology patients who are undergoing cancer therapy and treatment. So we're looking at the impact which we can promote healthcare over the long term and in the treatment of oral disease for those patients with oncology problems, and develops an appropriate referral pathway of oncology patient to the pediatric dental team. Here we try to improve the care provided by the hospitals with all patients with will not be neglected by health personnel, because when they first diagnosed, straight away they refer to us, send them to our clinic, then we will try to make sure that they follow the best oral hygiene practice to make sure while having the treatment like radiology or chemotherapy, they don't really facing lots of problems in relation to oral hygiene. And determination of perception on the importance of oral health. This definitely, we look at it and the way we give a questionnaire, and then we study the questionnaire and what's the best for us to promote with the result, then we can promote a better quality of life for patients and their parents, and meaning their family as well. And for sub-program 2, we found out the assessment of psychological distress level and factors that leads to the distress and spiritual distress among the patients. And for this, we can enhance parental acceptance during breaking news session, then when they first heard that this child having this onco problem, and when the child condition getting worse, relapse or palliative phase, they are ready to accept it, with the psychological distress and spiritual education that we give to them, lead them to accept the situation. And assessment of physical, emotional, spiritual, and financial strain faced among the caregivers and family. Yes, some of them came from the rural area that being referred to our hospital. And with this, we identify, we assess, then the approach should be different, depends on their social background, and we optimize spiritual and mental well-being and improve their care towards patient and maintain their family functioning. And I think this is very, very important. And the sub-program 3, which is quite difficult to get because of the parasitologist came and telling me, we have one master student that worked on this. It's difficult to convince the patient to let us, collect their stools. And then with the convincing, we need to convince and pay some of the nurses in the wards, to take parts, convince the patient at convenient time. So it's very, very important for us to try by any ways to make sure that the patient, especially the parents, give a cooperative towards what we want to achieve. And identification of opportunistic intestinal parasitic and oral bacterial infections done. And then again, we recommend it to be included as part of a routine diagnosis for those patients. And the comprehensive understanding on clinical manifestation, diagnosis, and treatment management against the pathogens can serve a better patient's management following cancer treatment. This is for recommendation for our healthcare worker on the other side, which is medical colleagues. Yeah? And the output of this research with 3 sub-programs, and we got the grant, which is about 210,000 Malaysian ringgit divided into 3. Yeah. So the output we're supposed to give is 4 ISI papers and 1 Scopus that we promised. And beside that, we got to get to have other media and whatever that we can publish to the public for better understanding is part of the agreement. And so far we managed to publish one paper under ISI, which is oral bacterial detection among children with cancer in a tertiary hospital in Kuala Lumpur, Malaysia. And actually we have 3 papers this in preparation to fulfill and we may have more actually because we have even for questionnaire development for parents' perception also we can publish as one paper beside output of the questionnaire that was given to the patients or the parents. And we have one book chapter that going to be published. And then we achieve proceeding under psycho-spiritual and we even have one patent for this psycho-spiritual work. And again, the editorial board of Tropical Biomedicine Journal has selected our articles to participate in their plain language summary PLS program, whereby they will publish it for the public to make it well aware of what's going on the output of our research. This is for this publication, I would like to highlight that maybe you can't really see the words from this publication. So overall, we got about patient that involved in this work out of 68 pediatric patients that we got together only, but it's good enough statistically for us to make a report on this. And for referral also, it's again, it depends on how many, because our postgraduate student and our research assistant go there once a week, but sometimes we have to go more often. And some of the patients are reluctant to give a consent for us to work or interview them, and so on. So we cannot force them, definitely. Right? And then this is part of a non-academic output that we can achieve. Media articles, it's a lot. We work accordingly because under spiritual work, under Islamic spiritual support caregivers has been developed, and then we also have a social engagement, referral session, etc. And then we involve a lot of the social engagement to help or to enhance the understanding or acceptance of these parent groups of child with cancer. Yeah. All right, and then this is the example of leaflet that we produce to be given to every patient that come to our UMMC, University Malaya Specialist Center, and some of them refer to our center in dental clinic. So we do provide them with this pamphlet that will covers everything that they need, because we know that their kids undergone radiotherapy and what needs to be done, what's the immediate effect of radiotherapy in relation to the oral hygiene, especially, and long-term possible effect also. And we teach them even and how to take care of their child's mouth during radiotherapy and chemotherapy. It's very specific in details. And this is 2 versions in Malay and in English. And okay, with the output of this research, and then we shall continue. Especially, we thought that in the area of the sub-program 3, which is quite promising and then more important for us to continue to look in the great detail to expand the research on this area. So the current knowledge regarding oral microbiome will be expanded with the participation from both adult and child patients undergoing oral cancer treatment. And we come up with a new research study entitled Elucidating the Effect of Pre- and Post-Chemo Radiation Treatment on the Oral Microbiome of Oral Cancer Patients. Here, our teams is the same. I mean, we invite more, but we're going to add the team from onco-medical personnel and also one of the oral pathologists or maybe the oral surgeons in our team to complete the coverage of aspect that we are looking at in this new work. And as we know, oral microbiome describes a highly diverse microorganism inside the oral cavity. The oral cavity is a complex habitat where microbes colonize and the hard surfaces and the soft tissues of the oral mucosa. And oral microbiome plays a crucial role in maintaining oral and systemic health. Aggressiveness of therapy adopted in cancer patients may cause the alterations in oral microbiota. It has been proved, although it's not very clear and certain, the pathogens may potentially cause opportunistic infections in immunocompromised individuals, leading to increases in morbidity and mortality. And also, the oral cavity is one of the most well-studied microbiomes with 392 taxa that have been successfully verified and 700 species of prokaryotype belongs to 185 genera and triphyla with 54% officially named, 40% are unnamed but cultivated, and 32% are uncultivated phylotypes have been identified in the oral cavity. And this includes bacteria, fungi, viruses, archaea, and protozoa that was found in the oral cavity. And Entamoeba gingivalis and Trichomonas tenax are common saprophytic protozoa. Candida species is the most prevalent fungi. Streptococcus eubacterium and Lactobacillus are gram-positive bacteria. Prevotella, Fusobacterium, and Veillonella are also present. And as we know, as a dentist, patients will come to us and keep asking a lot of questions, even non-cancer patients, when we explain those with the rampant caries. And some of them asking us why, even his children brush 2 or 3 times a day, but still the cavity, the decay is high, and to a certain extent, the neighbor or the previous child didn't even bother to brush their teeth. But there's no decay, very little or less decay. So how do we explain? Because it's multifactorial, yes, but again, we also need to mention that there's a lot of microorganisms, but some are carcinogenic, some are non-carcinogenic. It depends on luck on the patient's mouth as well. If more carcinogenic microorganism is there, then they are more prone to decay. I hope you all agree with me. Yeah. So sometimes we got to reassure the parents. Some parents feel guilty. Is it my fault? I've been brushing. It's my technique. Work or not? But why? But after all, we got to explain the best. This multifactorial. It depends. But the basic ground rule is just brush twice a day, effectively gargling that we mentioned to them. But again, even though you have done that, or non-decay, whatever, one day they come back to you, why? They fell off, and the tooth gone as well, trauma. That's another thing. Yeah. So I try to relate, because rather than look at the text and the number, And oral cancer is ranked 6th most common cancer worldwide. Most oral cancer cases are oral squamous cell carcinoma. In Malaysia, oral squamous cell carcinoma is among the most common types of cancer. And Most of the OSCC are preceded by oral potentially malignant disorders, and OPMD refers to a family of morphological alterations, amongst which some may have an increased potential for malignant transformation. And if you look at the diagram here, there's a risk factors of higher incidence of oral cancer, and these factors are tobacco, treatment delay, so with delay of treatment, so can give risk to the incidence of oral cancer. Chronic irritation, even from denture, for the adults, it can cause oral cancer as well. And sunlight exposure, bitter quid chewing in our area, there's a lot more people still practice the bitter quid chewing, alcohol drinking, and also tobacco. Right. So this is problem statements of what we look at before we go on with our planning to do the work or research work. So there's a reduction of local and systemic immunity leading to an oral ecosystem imbalance. We knew that it should be accepted, this statement, because it came from with the facts. And patients may acquire drug-resistant opportunistic infections from altered microbes in the oral cavity. And there is a need to study the exact role played by the oral microbes and their impact on pre- and post-cancer treatment. No study has been done that we found in Malaysia. Yeah, and this is the first study to elucidate the microbiome diversity among oral cancer patients before and after chemoradiation treatment in Malaysia. And you can do that in Indonesia also, in population. Or maybe you have done it already and not been published yet. Yeah? Or thinking about that in the same manners. Yeah? Right? And these are the research hypotheses. The oral microbiome composition among oral cancer patients is more diverse at baseline than after treatment. The oral microbiome composition is different in the gingival crevices, buccal mucosa, and tongue surfaces of oral cavity. There's a study shows that. Yeah, there's a differences even with the other area, but this is the most common area where the squamous cell carcinoma can happen. Yeah? The abundance of oral microbiome communities varies between children and adult patients. This is hypothesis that this is what we are looking at. We try to prove that with the research questions, whereby we said that we question that is the oral microbiome composition in individuals with oral cancer more diverse at baseline before treatment than after receiving treatment? Is the composition of oral microbiome different in gingival crevices, buccal mucosa, and tongue surfaces of the oral cavity in individuals with oral cancer? Is the abundance of oral microbiome communities different in children and adult patients? And again, if you do the study, we want to have a grant from the government or even internal grant from our university, we have to look at something that can relate to the government policy, because whatever we do, we must know the output that must be beneficial for the public, whatever we do. We don't just do the research that only to publish, because we have KPI. To get more publication, the better you are. But we got to look at the output, which should be beneficial, clinical, beneficial to the public. That's more important. Oral microbial ecosystem is vital to maintain the oral and overall health of human body, not only for oral hygiene, the mouth, but throughout affect the human body. The baseline information in handling and managing oral cancer patients, especially before and after treatment, is important. The information regarding the organisms present in their functional potential via metabolic pathway genes, you got to look into that, and then we need to study, we must know that. And then this valuable knowledge is very, very important to government dental care facilities to embrace the concept of the balanced oral microbiome, and it's important in oral and systemic health. So So the general objective of this work is to understand how chemoradiation treatment affects the diversity of the oral microbiome among oral cancer patients. And the specific objective is to investigate the diverse composition of oral microbiomes amongst oral cancer patients before and after treatment, and to determine composition of oral microbiomes in the gingival crevices, buccal mucosa, and tongue surfaces of oral cancer patients to compare the abundance of oral microbiome communities between children and adult patients. Okay. So this is the methodology. Of course, we need to have the ethical approval from ethics committee. Here, Faculty of Dentistry, we have our own ethics committee, and we can submit our proposal online, and we got to pay for it, and it's a must. Ethical approval is a must, and patient recruitment based on inclusion and exclusion. Inclusive and exclusive criteria. So we did the statistic workout, and then we need about 250 samples, which is a bit challenging. We may expand to other center beside UMMC. We didn't get enough patient. Specimen collection in 3 different sites: buccal mucosa surface, gingival crevices, and tongue surfaces. Why we choose this surface? What we got to justify why we choose these surfaces, because this is the area where it's more susceptible to oral cancer, and we do this based on literature that we look at, and of course the inclusion criteria and exclusion criteria that we choose is patient who underwent cancer treatment irrespective of age and gender, and also had been diagnosed with oral cancer. For exclusion criteria, a patient who refused to participate, we expect this based on our experience, because they had enough, and then some of them referred from very far, and then just after the treatment they come on and off. Sometimes we may not be able to catch them even though they are warded in the UST Malaya Medical Center, and those patients that was on medication prior to cancer treatment, so we exclude from the samples. And phase 1, we before the treatment, same goes to the after treatment, phase 2. We culture and staining protocol will be done. Genomic DNA extraction will be done, and DNA amplifications, cysteine sRNA, amplicon sequencing. All this procedure methodology will be done. And we also continue to do metagenomic analysis, whereby we do pre-processing and quality filtering, trimming and pair and sequences, RNA sequences, diversity analysis will be done, taxonomy analysis, and also prediction of functional profile by PICTRAS, the programs that we have. And when we mention about the after treatments, it's 3 months after the treatment. We got to look at why. We have the reason why. So what do we expect from this work? We do expect that continuous surveillance for a prompt examination, testing, and careful monitoring of this patient with the oral cancer. Importance for a long-term care in reducing morbidity, and give a good quality of life to them. And the impact on society, academia, government, industry, and environment. So comprehensive understanding with better evidence on oral microbiome associated with the effect of chemoradiation treatment. We will hope we can get that, and then we will publish it in open access journal and self-archive in the publication in Pablon's ResearchGate, and linking profiles, and full acknowledgement to all government, state agency, higher authority, and centers to involve in the study. Maybe later on, whatever that protocols that can be published out of this, will be discussed and further acknowledged to them or to the higher authority. Okay, I think that's it. I got only half an hour lectures to share on this. I do hope it will be beneficial, and part of it is to give some ideas of what needs to be done. Here is what happening in Malaysia, but there's other area that being more and more advanced than whatever we do here. Also, I do appreciate and understand. Yeah, but this is what my team working on since maybe about 3 years ago, and we got to continue looking to expand the research accordingly. But again, whenever we try to planning for the research a new area, we must look at what is lacking in our area, in our country, what is needed. We're not going to repeat what has been done in other part of the world, but again, to a certain extent, maybe we can, because the nature, if it was the nature of a different culture or the climates, that may affect the result or the output. So thank you very much, everyone, for your attention. Maybe I will stop sharing.
Thank you, Professor Sabri. Maybe I have some question here in the chat below, in the chat box, but Dr. Annie maybe want to ask you directly, Prof. Sabri, if you don't mind.
Yes, Prof. Sabri, I'm really curious to ask a lot of things, but while listening your lecture, I'm mesmerizing with how massive this collaboration work was, and how long did the program running, Prof? Is it already finished, or is still?
For the first part, it has been running for 2 years already.
Yeah, 2 years.
Yeah,
and still running.
From the beginning, it's still running, and we started from the beginning, whereby we collaborate interdisciplinary. We plan because this is focused on oral cancer patient, whereby the team coming in, the academic Islamic studies coming in on psychospiritual, and also the parasitology coming in, and it's still going on to a certain extent because of COVID pandemic coming in. It affects us a bit. But
I understand.
We will to expand until May this year. But at the same time, we have seen we almost got all the result. We published one paper, and then we sent 2 paper already, and then we're supposed to publish 4+1, 4 ISI1 scopus on this. And all in the result is all there already. So in the stage of writing out. But we still need time for that. But at the same time, we got to work out now as a follow up. So we can't afford to.
And it was a brilliant idea as well to get collaborated with the Islamic department to see the religion approaches for these diseases, which for me, I never thought about that the actually dentistry department could ask for help with these religions. How this idea came from?
We have we call interdisciplinary research collaboration that imposed by the management. But what strikes me to do this, because we been doing walk rounds at the our oncology ward at University Malaya Medical Centers, and that is why in each group sub-programs, 3 sub-programs, we put all the oncologists we invite. They have the MO medical officers specific to oncology. So we put each of them in every group so they can assist us during sample taking or whatever, interview the patient over there. But of course we got to contribute as well. Yeah.
Do you
So
have a specific oncologist for oral environment, Prof?
for or what you mean by oral environment?
Specialistic
Yeah, we have.
specialistic department for oral oncology.
Yeah, we have specific department for oral oncologist. Sorry, for oral oncologist, I think we in pediatric department, not specific as oral oncologist, no.
Okay.
But we work with oncologists from the medical side, medical.
Oh,
but
okay.
Again, we for next coming program, we invite oral pathologists and also oral surgeon, you know, that work.
Yeah. It's really massive collaboration, Prof. We really need to learn from this program. Thank you so much, Prof. If you don't mind, we can discuss later on regarding this, and we can learn how we can do this kind of project.
Yeah, sure.
Thank you so much, Prof.
Not at all.
Thank you, Dr. Ernie. Okay, Prof. Sabri, we have some question here. The first one is coming from Dr. Gigi Nur Hikmah, ask about what is the most appropriate approach in providing information to patients and families of pediatric patients regarding the malignancy experienced by children, and what are the difficulties? Thank you, Prof.
Thank you for the questions. Yeah, this is the issues that we facing. You know, whenever we in the pediatric clinic, we often being referred the patient from our onco side, which is at the late stage. Sometimes after the treatment, radiology or chemotherapy is being done, right in the middle, whereby we cannot do anything because the state of patient is not allow us to do some GA for extraction, you know, because they have a lot of mucositis, a lot of problems, consequences of the radiotherapy of chemotherapy that happen inside the mouth. So what we do, the approach is once they diagnose, before they go for any treatment, they must be referred straight away to us for us to, you know, give oral hygiene instruction, to do all the fillings, and then, you know, to the parents, to educate the parents, you know, how important, and we show the photo of the mucositis or whatever the consequences that going to happen inside the mouth to the parents and to the patient themselves, you know. So upon that, when they're ready, then only we send back to the UMMC, say we have done this, and then they can go ahead with the treatment. So I think this is very, very important. The difficulty is sometimes patient, even though they've been referred, they won't turn up, you know, referred to us. So what we did is, you know, not only referred, they were sent straight away from that clinic to our center. If they give an appointment to us, most of them won't turn up, you know, because they had enough problem. They say, you know, they go to the medical side and then to refer to dental side. If we look at the referral, because that's why we do clinical audits, you know, for the patients that being referred straight away, or we go there and look at them, get the number. And again, at the beginning for our medical colleague, also at the onco clinic, not the ward, yeah, not being warded, the onco clinic, they see the patient for the first time. Before this, some of them didn't even bother to refer to us. If the patient did say that they're not having problem, dental problem, only those with the dental problem before the treatment for oncology will be referred to us. So, and we developed the pathway of referral. We mentioned to them, it's a must. That's why we engage all the MO from each ward of oncology that also go to the oncology clinic. Tell them that it's a must. Whenever patient came, diagnosed, you must fill out the form, send it to us. So yeah, but we must have session, certain date for them to send. And then if possible, we do the session at the same day, same session as they have over that clinic for our dental session here. So the patient won't miss. Yeah.
Okay. For the second question is from Dr. Nur Asmi. She asked about oral mucositis is one of the complications that occur in the treatment of oral malignancy, which is often accompanied by infection with other microorganisms, such as bacteria and fungi. What do you think about it? And how is it managed in pediatric patients?
Well, it's a good question also. Yeah. Similarly, so whenever we go for walk round with our postgraduate students, when we see the patient that's being treated under chemotherapy, most of them having this sort of problem, mucositis and so on, and it's sad we can't do much, we to a certain extent we can try to debride, advise them to gargle to a certain extent, or even we got to be careful. Some of the kids, they cannot even know how to gargle properly, so we got to do clean up from there for them. Yeah, and again, sometimes they having decay, acute abscess, and we find it's more difficult for you to help them, unless you put them under GA. But even though you want to put them under general anesthesia, put them to sleep to treat them, certain patient, the physically or the conditions not allow you to do so. Yeah, unless it's very, very urgent, very important. And sometimes the slot that you have, whether you can or not, because if it's under private wing, they can pay, it's okay. But most of these patients is patient that cannot pay. So under our list, and our list is limited for general anesthesia in hospital, the OT, operating theatre. I think we're facing the similar problems, isn't it? Yeah. So sometimes you feel helpless to help them. That is why we try as much as possible when the first diagnosis, straight away send it to us, then make sure that's the key. But unless it's too late and it's happened already, we try by any means to minimize the pain, struggling at the bedside, try to relieve the pain for them, try to clean up, and then try to advise them what to do, to brush, to drink lots of plain water, and so on. Yeah. So it's tricky and it's a bit difficult. I admit that.
Okay. Next question. Assalamualaikum warahmatullahi wabarakatuh. Introduce, my name is Aziza Azahra Burhan. Based on the doctor's experience in treating patients with oral malignancy in children, how do you recognize the early clinical signs that the patient's condition is malignancy?
Right. I will admit I don't do much clinical for adult patient, but I do see once in a while patient came referred by the private practitioner to our center, because I do the University Malaya Specialist Center clinic also for those who can afford to pay. Beside our clinic, at general clinic, they come for normal patient. Yes, they come, some of them with leukopenia, white lesion, red lesions, but most of them started with white lesion and any sign of red lesions. So you must be curious. You must know what that may lead to oral cancer. Whenever you curious that things that you cannot scrape off, ulcer, whatever inside the mouth, or the lesions inside the mouth that you found out, you don't hesitate to refer to the more appropriate person. You must work in hand with your colleagues from other side, oral pathologists especially. Yes, again, you still must know basic things that what to look at. Even it's rare in children to have that, but once in a while, yes, we have very aggressive, especially that related with the bone resorption inside. When you take radiograph, you see signs and symptoms inside. But the lesion that occur in the oral cavity and soft tissues, you must be alerted, because some got confused with the normal lesion that was not can be recognized as the malignancy or can lead to malignancy. But any curiosity, you must refer to the specialist.
Thank you, Dr. Sabri, for the explanation. And there are from Dr. Helwianti Umniati. Do you also use a palliative approach to cancer patient?
Yes, we do to a certain extent. It depends. Yeah, it depends. So we do, and we have our team complete, which does include the oral surgeons, and in fact, in University Malaya, we we are the Centre for National for Banking of Oral Cancer in Malaysia. So and then we involve all discipline, especially preventive department, oral maxillofacial, oral medicine, oral pathology, even the adults, restorative, and also the pediatric. Yeah. And we work closely with the University Malaya Medical Centers, with the specialists over there as well.
Okay, thank you, Prof. Maybe one more question, Prof. I'm gonna ask. According on the many predisposing factor for the occurrence of oral cancer, which one commonly find in your patient that occurs in children? According to many predisposition factor that occur in the oral cancer, which one is commonly find in your patient, Prof?
Sorry, can you repeat again the question?
According on the many predisposing factors for the occurrence of oral cancer, which one is commonly find in your patient that occur in children?
In children, is not many actually, but still the oral cancer still happens. And then from my experience, I have 1 or 2 cases that I've seen direct come to me under private wing. Normally at the back of the, I think for Roslyn to see a lot, many at the back of the tooth and related with the tooth unerupted. We started with the cyst. It's interrelated. So I think that's my answer. For children, it's quite rare actually, but I've seen few in the advanced stage. They will come with complaint of unhealing redness, and also swelling on the area. It's more as compared to for oral cancer, compared in children as compared to soft tissues, more involve the hard tissue or inside the bone. Right.
Thank you, Prof. Maybe if you don't mind to choose 2 best question for get the door prize, Prof.
Oh.
For this session.
For the best questions.
Yes.
Yeah. For the best question, I think regarding the all the questions is good. It's a good question. Dr. Annie also asking a very good question, but I think Dr. Annie shouldn't be in the competition. Yeah. Is she entitled to that? She asking a good question on how we manage, how to, collaborate. I think that's very, very important for us at the as an academician, But as for public, the question that you should know is oral mucositis is very, very important. But what I go for this question. What is the most appropriate approach in providing information to patients and families of pediatric patients regarding the malignancy experienced by children, and what are the difficulties? So it goes to Dr. Gigi Yaya.
Dr. Nur Hikmah. Okay.
Sorry. Dr. Nur Hikmah.
She mentioned me.
You are Dr. Sorry. Yes. Dr. Nur Hikmah. Yeah.
Dr. Nur Hikmah mentioned me. Okay. Okay, thank you very much, Prof. Sabri, and ladies and gentlemen, before I close the session, I would like to take the conclusion from what the speaker has presented. It is recommended that all newly diagnosed pediatric oncology patients to seek early dental consultation to allow adequate time for necessary dental care to be complete prior to initiating cancer therapy, and continue to place emphasis on preventive intervention. And I'd like to thank to the speaker for the great informative and interesting presentation, and for all the participants for the active participation. Finally, I am apologize if there are any mistaken, and hopefully we will see you again in another meeting online or maybe offline ways. Keep sound and healthy.
If it's getting better, I do hope I can pay a visit to Unhas.
Amin. Thank you for your kind attention.
And welcome you all to Malaysia.
Malaysia. Okay, amin. Amin. Hopefully the pandemic gone soon, yes, Prof.
Yep. Thank you. Thank you very much.
Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, and I'm giving back to Master of Ceremony.
Thank you.
Thank you.
That's the lecture from Professor Dr. Sabri bin Musa. Thank you, Prof, for the information and knowledges. And we would like to welcome Dean of Dentistry, Faculty of Hasanuddin University, Professor Muhammad Ruslim, in delivering the certificate to Professor Dr. Sabri bin Musa.
Thank you.
Thank you.
Professor Sabri,
yeah,
we would like to deliver your certificate.
Thank you very much.
Again, we express your contribution. We are my gratitude. Thank you very much for your sharing your time and your knowledge to us. Again, thank you very much, Professor Sabri Musa.
Not at all. Thank you. And
we hope we met soon in Indonesia or in Malaysia.
Inshallah.
Soon.
We hope all things
thank
get
you very
better.
much.
Yeah. Thank you. Bye. Bye. I shall leave the room, yeah?
Thank you, Prof.
I should snap the photo. Thank you.
Thank you, Prof.
Bye.
Thank you, Professor Dr. Sabri bin Musa, and we would like to welcome again Dean of Dentistry, Faculty of Hasanuddin University, in delivering their certificate to our moderators, Yaya Inaya DDS and Pediatric Dentistry Specialist.
I also deliver certificate to the moderator.
Thank you, Doc. Thank you, Prof.
Thank you very much, Dr. Inaya, for your contribute as a moderator. Again, thank you very much.
Thank you, Prof.
Once again, thank you to Professor Muhammad Ruslim, Professor Dr. Sabri bin Musa, and our moderator, Yahya Inayah, DDS and Pediatric Dentistry Specialist. Ladies and gentlemen, next we will move to our second session. And before we move to our next session and welcome our moderator for the second session today, let's see our moderator's profile in advance, as you can see by video on your screen right now. Thank you. And without lingering, let's welcome our moderator, Yosi Yuanita Ariestina, DDS Specialist and Consultant, Oral and Maxillofacial Surgery. Time and screen are yours.
Thank you very much for the MC. Thank you for introducing me. Before I start, I'd like to thanks to all of the committee. The chief of the committee already invited me to become the chairperson for today's session. And this is actually a very interesting topic that we are going to listen about the usefulness of readout segmented echo-planar imaging, or RESOLVE, for biophantom imaging using 3 Tesla clinical MRI. This is a very interesting topic. I personally barely can wait to listen to our next presenter. Before we start, I would like to read out a little bit about the summary of the biodata of our presenter. He is a professor of oral and maxillofacial radiology. As you can see, this is the profile of our speaker. Thank you very much for presenting the profile of our speaker, Professor Babatunde Olamide Bangbos, if I'm not mistaken. I would like to welcome to Professor Tunde. Hello, are you there?
Yes, I'm here. Good afternoon, Malaysia.
Hello,
Indonesia.
good afternoon, Professor.
Good afternoon.
How are you?
I'm very well, thank you.
It's very nice to see you, and it's very nice to have you to present your expertise in this 7th Icobtd in Indonesia. We are ready whenever you're ready, Professor.
Okay, all right. Thank you very much. Before I start, I would like to congratulate the Dean, Professor Muhammad Roslin, for his chair and the inaugural lecture that he is given as a professor of oral and maxillofacial surgery. There's a small story to tell about Professor Muhammad Roslin. He happens to be the editor-in-chief of the faculty journal, and my friends Irfan and Achin introduced me to the journal. They wanted me to help the journal get going. And the editor-in-chief, I only knew the name, Roslin, and I will contact him and I will harass him. I'll say, hey, what's happening to this manuscript? What's happening to that work? And he will kindly respond. I did not know whom I was talking to. I just knew we were just talking back and forth on email. And look at him now, he's a big man. I didn't know. I actually thought it was someone like my friend Irfan. So I was talking to him like I would talk to Irfan. I didn't know I was talking to the dean. Salam alaikum.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Tunde.
Thank you very much. Thank you very much.
Of Faculty of Dentistry in Nigeria.
Thank you. Thank you. It's good to be here. And
yeah, I really miss you also. We just connected with email, and then now we are in virtual, and I hope in some day we can meet each other, yeah, in Indonesia or in Nigeria.
Absolutely. I look forward to that. After this conference, I will talk to you about establishing collaborations between the two institutions so that we can have research exchange and
it's great.
things like
it's
that.
Great.
That's good.
Okay.
All right. It's good to be here. All right.
Okay, thank you.
Thank you so much.
Thank you very much.
Thank you very much. Thank you very much. Okay, so I chose this particular lecture or presentation because it has connection with Japan, Indonesia, and Nigeria, particularly because of my good friend, Irfan Sugianto, we worked on this study together. So I thought it would be something to present that would honor him and honor the Dean, Professor Mohammed Roslin, in whose honor we are making this presentation. So it's an imaging presentation. It's basic imaging, lots of physics, MR imaging, a bit technical, but I will try to break it down in a way that we all can understand. So we'll be looking at the usefulness of readout segmented ecoplanar imaging resolve for biophantom imaging using 3 Tesla clinical MRI. These are some of the authors and co-authors. I didn't want to put all the names, but for sure, I had to include Irfan's name on the list. And our professor out in Japan at Okayama, Junichi Asaomi, and the leader of the study in the laboratory where we conducted this research, Professor Kuroda Sensei. So they are part of this, and my name is Babatunde Bangoshi. The study was supported by grant from the Ministry of Health, Labor and Welfare in Japan. By way of introduction, in the Kuroda lab, again, I mentioned that is the laboratory, that was where we conducted the study. So the name of the leader of that lab is Kuroda, we call him Kuroda Sensei. He has interest in basic research on tumor ADC values. And we took it down to the cellular level. For the MR, we use DWI MRI, and it's useful for tumor diagnosis and treatment. At the moment, this is used for CNS, the brain imaging, prostate, and breast, but we are hoping to migrate this to the maxillofacial region as the study continues. So diffusion-weighted MRI is useful for tumor diagnosis, and for treatment planning, and for prognosis, particularly because you attach the ADC value to the DWI, and that really helps to know exactly how the tumor is behaving or responding to treatment. There are many unclear points about the mechanism by which the ADC value decreases in tumor. So that's the clinical part of it. When we image using MR, diffusion-weighted imaging sequence, you realize that the ADC value, the apparent diffusion coefficient value, decreases in tumor. Therefore, if you institute treatment for the tumor, maybe chemotherapy, sometimes even surgery, and you begin to see a positive response, if you image the patient, you should expect that for normal tissues, the ADC value will increase. And that's where the clinicians will be able to benefit from this approach. The ADC value will increase in normal tissues, it decreases in tumor. That's a clinical point. However, the mechanism is unclear. And in this laboratory, we went to have a better understanding by going at the molecular level to understand the reasons why the ADC value will decrease in tumor and how to better understand that. In the first instance, a study had been published out of that same laboratory in 2009, where 1.5 Tesla MR was used to measure the ADC value, and cells were created, Jocard cells were created for that, and we put the cells in the phantom. So here, this schematic shows the phantom in the first instance, and the biophantom in the second. The first instance, you have the Jocard cells, and the second, you have the biophantom itself containing tumor tissues, and in the other one, you have the mouse liver into which the tumor was transfected. And these were all imaged. And we took samples of the cells, and with sonication, you got different cellularity. And what this shows is, as the cellularity of the cells decrease, you see that the extracellular space also increases. because you have more cells, you have cells here, but it increases, it decreases further on. So as that decreases, you get better increased extracellular space is what this schematic is showing. And the graph here in the basic study that was done shows that the ADC value would, in the first instance, increase with temperature. And that is important. And also, if you look at this here, now you see that the cellularity of the cell also affects the ADC value. And as you have the cells changing and increasing in cellularity, there is going to be a drop in the ADC value. So for swollen cells, the ADC value is quite low at this level. But as you increase the sonication of the cell, you have increased cellularity of the cells, the ADC value will just continue to increase. And that has an effect on the cellularity and the ADC value that we're able to create. And that was the first study that was done, and that was the basis for this additional study that we are doing. Now, in the first study, we used 1.5 Tesla MRI. In the second study, this new study that I am presenting, we used 3 Tesla MRI. And there is a difference between 1.5 Tesla MR and 3 Tesla MR. The 3 Tesla MR has advantages over the 1.5, including the fact that it has better high signal to noise ratio. In fact, it's 2 times better in terms of signal to noise ratio. It also gives better resolution and the imaging time is shorter. However, it has disadvantages, including chemical shift. So one of the disadvantages is the chemical shift that we experience in the 3 Tesla MR, and that leads to artifacts. You have lots of artifacts that will affect image perception, and the artifact is due to the increased magnetic susceptibility effect, also non-uniform magnetic field within the 3 Tesla MR. So we will, in our study, we will want to see how we can use Resolve to improve on the disadvantages of the 3 Tesla MR to give us better resolution and reduced artifacts. It's basically another part of our study. So the second part of the basics of the study is the fact that we had the control distilled water polyethylene glycol also in the tubes that we used, and we're able to get the ADC map of after imaging that on the 3 Tesla machine. And the basic part is to use the head coil. The dimension of coil becomes important depending on the size of the region you are imaging. At the molecular level, using the head coil may have a disadvantage. So on the next slide, you will see how we were able to improvise some special coils and a large coil apart from just using the head coil, and we were able to compare those in the study. So with this layout on the 3 Tesla machine, we wanted to see how this will affect the phase direction artifact, including the N-half artifact, and also see how that would affect the ADC value, the inaccurate ADC values. The N-half artifact on the MR machine, the 3 Tesla machine, particularly because of the EPI, the ecoplanar imaging, which is the opposite of the Resolve, the radar segmented ecoplanar imaging, and EPI, they are 2 sides of the same coin. So this is the opposite side. The ecoplanar imaging, in addition to the fact that phase encoding magnetic field is weak, and the weak echo of even the positive and negative rows of the K-space, artifacts appear so that the image is shifted by half in the phase direction. So in the phase direction, you see in this case, the image is shifted by half. And you can see this is the real image, and that is the shift. That's the N-half shift. And the reason for this N-half shift, because of the magnetic field inhomogeneity and eddy current. And also you have instability within the machine and incomplete gradient magnetic field. All of this put together create this uncertainty. and lead to the N-half artifact. And it's impossible to remove the entire eddy current within the machine, but it can be magnified by reduced by the system that we're trying to present today. So this research that we're presenting was done in 2018, but since around 2015, there has been improvement in the reduction of distortion within the MR machine, particularly using Resolve. And we went to use Resolve for BioPhantom for 3 Tesla machine using for clinical use. We examined the usefulness of Resolve and we compared that for distortion and phase direction artifact alleviation. We compared Resolve with EPI. So the direction could be phase direction, it could be readout, and it could be slice selective direction. But for our study, we use the phase direction to determine how to alleviate the phase direction artifact. The objectives of the study were: 1, to study the signal to noise ratio on the 3 Tesla machine, to understand distortion and see how we can reduce that using Resolve, to also see how we can reduce the artifact in the phase direction, and also evaluate the ADC value of the BioPhantom. In doing all of this, we continue to compare Resolve sequence with the conventional EPI. Remember, I mentioned that the Resolve and EPI, they are 2 sides of the same sequence. For EPI, it's just one huge K-space. But for Resolve, the K-space is segmented such that the defacing is minimized and the sequences can be done and repeated in short time and you don't have too much artifact. And that was the physics we used in doing this. So again, for objectives, we wanted to see how Resolve will affect the signal to noise ratio. We wanted to see how signal will affect distortion. We wanted to see how Resolve will affect the artifact in the 3 Tesla machine and also the accuracy of the ADC value. All of these were designed to improve on the image quality of the 3 Tesla machine compared to the 1.5 Tesla. For the phantom in this study, we had the liquid phantom, like I showed in the previous slide. The physiologic saline was used for signal to noise ratio and distortion examination. The PEG, polyethylene glycol phantom, was used to consider the phase direction artifact. And we used the BioPhantom to determine the accuracy of the ADC value. The equipment we used included the 3 Tesla MR machine, the large loop coil that we also incorporated, and we used a special purpose coil. Remember again, I mentioned that the special purpose coil and the large loop coil we're using is because of the small material that we are imaging. Clinically, the is used is dependent on the degree of anatomy that you want to see. So this doesn't have to be carried into the clinics, but because of the small tubes we're looking at, this served us better than the head coil, and we will see the comparison as we move along. Also, as part of equipment, we designed a self-made heating apparatus. And we have the water bath here to heat the water, and the water goes through the tube. And in this container, we have the fiber optic cable that goes through as a thermometer to determine the temperature of the water. And the temperature is measured and displayed on the screen in a way that we can keep the temperature at a steady state of 37 plus or minus 1 degree Celsius throughout the study. So the first part of the study was to measure the signal to noise ratio. And for that, we use a physiologic saline. We use the B value of 1000 at room temperature, and the sequences are displayed up here. Remember again, we're going around the phase direction of phase encoding direction. just to be able to measure that. So this is the sequence in case it's going to be repeated, and it was done for resolve and for EPI simultaneously. And for the signal to noise ratio, we got 2 scans, and we used ROI, and ROI at 7.7 pixels. We combined 2 scans to create a subtracted image, and the cumulative subtracted image of all the pixel points on the image was combined to get the SNR map that will now evaluate it. So we calculated the SNR map for each pixel, and the map it to create the SNR map. And that's what we have there. So the result of the examination of the signal to noise ratio using different sequence, the large coil and the special purpose coil at B value of 1000 for resolve and EPI, we saw that the signal to noise ratio was better with resolve compared to EPI. So therefore, the conclusion at this point was that resolve improves the signal to noise ratio on the 3 Tesla MR. Now, for the different coils, the signal to noise ratio for the different coils. For instance, like mentioned, we use special purpose coil and large loop coil for our study. What if you use the head coil? What will be the difference? The head coil is a conventional coil that we use for head and neck imaging. What if that was used for this study? Okay, at B value of 1000, and we got the signal to noise ratio map for both setup, special purpose coil, loop coil, and the head coil. We also discovered that the signal to noise ratio was better with the special purpose coil and loop coil than using just the head coil. And therefore, our setup improved our signal to noise ratio. The next part was to examine distortion. And to examine distortion, we had a setup for physiological saline, the loop coil and the special purpose coil and the B value of 1000. And we imaged at room temperature, again at the phase encoding direction. And this was a setup. And we also got our measurements for resolve and EPI. So for distortion, we do T2 weighted imaging, resolve and EPI. So in the upper sequence, we have the phantom filled with the liquid physiological saline, and in the lower section or segment, we reduce the volume of the liquid, the physiological saline, to incorporate air and into the setup. So what we discovered was that, and for distortion, the measurement is not arithmetic, it's not calculated. You have to look at it visually. So here we can see that everything looks good. The images are clear, and you can see that there is less distortion here. But when you move on to resolve and EPI, because for imaging, you have to use either resolve or EPI. When you move on to resolve or EPI, you see that where you have air and water and saline within the phantom, distortion appears less compared to EPI. Therefore, in any sequence that we may do, the more air there is, the more distortion you have. However, resolve improves distortion than EPI, and that will be the summation of our result for distortion. Now, we went on to look at phase direction artifact, basically removing artifact. And to examine artifact, we used PEG, the polyethylene glycol, in addition to the other setup of coils, large coil, special purpose coil. However, in this case, it was not imaged at room temperature. We actually had to use the water bath to heat the liquid to 37 degrees Celsius plus or minus 1. And we imaged that for resolve and EPI, also using the phase encoding direction. Initially, we calculated the ADC value for each pixel in the ROI for diffusion weighted image using the natural log of the signal to noise ratio against the B value, and we inverted that, multiplied it by -1 to calculate the ADC value. So that was how the ADC value was calculated. This is just the mathematics of it. And because the ADC value had to be calculated, the phase directional artifact analysis had to calculate along the longitudinal dimension of a phantom. So we needed to create an Excel spreadsheet to measure the phase direction artifact along the tube. And we got the ADC value from 0 to 1300 B value and multiplied that by -1. And when we did that, we were able to ascertain that for PEG, resolve an EPI ADC map will give us this. And if you plot that, you have the ADC value on the vertical axis and the B value on the distance from the bottom of the tube on the horizontal axis. We discovered that the ADC value distortion or the artifact for resolve was narrower than that for EPI. So for resolve it was 4.82 mm, whereas for EPI was 11. So therefore, the resolve gives a better presentation and reduction of artifact compared to EPI. That's what this just shows. So with resolve, it is possible to measure ADC value more accurately than EPI. But in addition to that, it also reduces the artifact. Now, for the ADC value using biophantom, here we used cells. We used Jocard cells. And Jocard cells are leukemic cells derived from human T cells. And we used the study that had been done in 2009 to create those cells. And we mixed that, got the centrifuge part of it, and we put that in the biophantom that was imaged. And we set up the biophantom in a way that we were able to get a phantom within a huge container using the heating device so that we could get the temperature to 37 degrees plus or -1. And this setup I already mentioned earlier on, and we had to take a recording of the temperature to be sure that we are within 37 degrees plus or -1. And this was a setup we used. The large loop coil, special purpose coil, B value of 0 to 2000, but we were more concerned with 1300 and the temperature. And this was a setup, this was how we imaged within the MR machine. And you can see the tube for water and the fiber optic cable going in, and this was a phantom within that, and this is the MR machine. So we did the measurement for DWI, MR, and we saw that for the resolve and EPI, resolve improves distortion. This is virtual. You can see that there is less distortion here compared to what we see in the EPI within the phantom. So we now went on to do resolve from 0 to 2000 B value and got the ROI from within the cell and also in the cell line. And we're able to plot the signal intensity against the B value. And if you look very closely, it became significant around 1,300 here. And we're able to plot that out for the phantom, that's biophantom, and the physiological cell line. And the value we got was such that the ADC value was 856 for the biophantom, whereas for physiological cell line, it's actually almost closer to what you get for normal cell line for water diffusion in the DWI, MRI. So for water, diffusion is going to be 3,000. But in this case, for our own phantom, it's 2,951, which is very close to normal. Therefore, resolve the Brown phantom gave us a very good result, and we were able to calculate very accurately the ADC value using our setup. So in summary, the possibility of imaging at cellular level using Resolve and on 3 Tesla MR machine was very, very positive and productive. In addition to improving distortion, it also improves accuracy of ADC value measurement due to improvement in the signal to noise ratio and reduction of the phase direction artifact. Those are things that we're able to confirm with what we have done. So Resolve, what is Resolve? It's an imaging method with small phase dispersion, and it reduces distortion. It has advantages of increasing signal strength and also increasing SNR. The disadvantage will include, that is for the 3 Tesla machine, it could have distortion due to phase dispersion. So Resolve is also always incorporated to augment the disadvantages of the 3 Tesla machine. So here is the difference now. So this is EPI and this is Resolve. So this is a K-space. It's just the raw data of MR is what the K-space is. Here you have the signals going, the echo signal going through the entire K-space for EPI. Whereas in Resolve, there is segmentation of the K-space such that you have short echo signaling within the compartments. And by so doing, this will reduce amount of dispersion and also reduces distortion within the image. And that is the difference between EPI and the Resolve. So we have, the Resolve has been used for breast imaging and prostate tumor diagnosis. Like I said, we are trying to migrate this into maxillofacial region to see how we can advance this study to better improve the quality of life for our patients. And in summary, again, this is the study that we have presented, and it shows that Resolve is very useful in tumor diagnosis and the other things that we do. Thank you very much for your attention. And here we were, Irfan and I, in the MR suit with, this is our professor, Professor Kuroda Sensei, and this is Yoshiura, the PhD student who was the PI on this study. So this was one weekend we were working in the laboratory together. All right. Thank you very much.
Thank you very much, Professor. It is very nice to listen to your presentation. And in this slide, I feel like I recognize one of the person in this picture.
You should. That is Irfan.
Dr. Irfan is one of our colleagues here in Hasanuddin University. Thank you very much. Okay, so Professor Tunde.
Hello, Tunde.
Hey, Irfan.
How are you? I cannot speak because the host mute all the participants.
Okay, that's all right. I'm all right. Thank you.
Good.
I'm okay. Thank you, Irfan. All right.
Okay, Professor Tunde, moving to your presentation. By listening and seeing your presentation, I feel like it's a very complicated, a very detailed software. It's a very sophisticated yet a very complex equipment, I suppose. And eventually, it will, yes, eventually it will result in a more smooth image with less artifacts, less distortion, and the pictures is better and more clean if we compare to the EPI software. Is that correct?
That is correct. That is correct. You're correct.
Okay.
It's very detailed. It's very, yes. Go ahead. Go ahead.
So, but is it difficult to implement it whenever we want to use the kind of software, whenever we want to do a diagnostic imaging for the specific tumor, maybe?
Okay, so it's not difficult. I tried to take it away from the basics of MR and from the physics of MR to the clinics as clinicians. You know, as clinicians, we look more at, here's a tumor, here is my knife, make an incision, take out the tumor, and patient goes away and close up. So we look at things more like that, but at molecular level, it looks different. So let me take it back to the clinics as a clinician. What we are saying here is that when there is tumor and you image the tumor using MR, there is something called diffusion-weighted imaging, which enables us to determine the degree of diffusion within the tumor or the lesion. And also, that particular sequence enables us calculate the ADC value, the apparent diffusion coefficient of the tumor, of the tissue. All of that I have just said put together, what does it translate to in the clinic? Here is a conclusion. The ADC value decreases in tumor. Okay, that is the clinical part. Therefore, if I have a patient that has oral squamous cell carcinoma or parotid lesion, and I began to treat, maybe conservatively, maybe first I did surgery and there were some residual tumor and I had to give chemotherapy. Now, given that I know that ADC value decreases in tumor, I want to now see the prognosis or the response to treatment by re-imaging the patient. And I want to look at the ADC value to see it increasing. There was a graph I showed where you had cells of different cellularity. You looked at the mouse liver, tumor cells, and the mouse liver was at the bottom of it, where the ADC value was quite low. And I said that, okay, so what that means is that if there is improvement, then the ADC value goes up, is what we are looking at. Now with Resolve or the EPI, I'm going to take the other question again. The Resolve and the EPI, ordinarily, the T2 weighted imaging will be okay if you are not looking at the cellular level and trying to make some increased diagnostic abilities. With 1.5 Tesla MR, you will be fine, and you may not have these disadvantages. However, because we are using 3.3 Tesla MR, 3 Tesla MR has some disadvantages, including artifact and distortion. Now, how do we improve? However, it has very good signal to noise ratio and gives us a shorter imaging time. Now, with the minor disadvantages of the 3 Tesla MR, how do we improve the quality of image? Ordinarily, we use the EPI, the echoplanar imaging, but with Resolve, we are bringing a new dimension to imaging, whereby you are able to now reduce the disadvantages of the 3 Tesla machine using EPI. When I showed us the sketch on EPI, it's like a huge box for the case space. But for Resolve, that huge box is now segmented so that you can reduce defacing. And you can reduce artifact, is why that has been done. These are not things as clinicians that we control, but it's going to be incorporated into the machine itself. You don't even need to do anything about it. Just put the patient there, choose the algorithm, and it works out and gives you the result. So that's the clinical way of looking at this study. And I have presented this study a couple of times, and I've always gotten this reaction. And here, Professor Roslin, if I may say, when I gave my inaugural lecture last year, this was one of the things I mentioned in my inaugural lecture, and I had to apologize to the entire audience that this part of the study will be very confusing, and it was confusing. So I can understand if Irfan will tell you that when we did this study, we were also confused, but we got it done somehow. That would be the answer to the question.
Thank you very much, Professor. That was very interesting.
Thank you.
I mean, I'm trying to understand. So, your study, it shows that Resolve have a better score of signal to noise ratio if you compare it to the EPI, if I'm not mistaken, right? So, allow me to read a question from one of the participants.
Okay.
From Dr. Gigi Fadlil Ulum Ar-Rahman. Thank you for your presentation, Professor. But I'm curious about the disadvantage of using Resolve in increasing distortions of the imaging. So how we make a deal with the distortions to obtain a diagnostic information? I mean, a high quality imaging for diagnostic information. I think you already answered this one before about, yeah, you already answered, if I'm not mistaken, about how you make a segmented, you fragmented the image, and then it's like this Resolve read the image each by each, and how to lower the distortion level. Am I correct?
You're correct. You're very correct. And yes, I answered it along with your question. You're correct.
Perhaps you have something to add about the answers for the question by Dr. Fadli.
Well, again, I read the question. I have it on my screen. So when I was responding to your comment, I also answered the question. So yeah, so to now ask, Resolve gives us a better image quality, gives us better ability to accurately determine the ADC value. Remember the last part of the presentation where we used the biophantom, where we had 2,951 for physiological saline and 256 for 456 for the biophantom. That was the ADC value. And I mentioned that for the physiological saline, it was 2,951, the diffusion. Whereas if you look at the regular water in the system, it is at 3,000 for diffusion. Therefore, it means there is a high accuracy with Resolve to determine the ADC value. So it's already accurate. The accuracy has gone up because we have been able to segment the K space. So when you compare Resolve with EPI, Resolve is better. And that is what the study has really showed. Now, if you want to improve on the quality of Resolve, that's another study in itself. And there is no reason why that cannot be done. But on this study, we compared the phantom, physiological saline. We use saline because it's the closest to regular, ordinary water that we drink. And it seems very, very similar in value to what we got from our study. We use phantom, we use Jocard cells. Jocard cells are like tumor cells, human T cells. We transfected that into mouse to create a tumor cell, and we harvested that, and we imaged all of that to create a semblance of the maxillofacial or maxillofacial tumors that we see, or even breast cancer, tumor in human bodies generally, to mimic all of that at the microscopic or molecular level so we could image. The other way to do this as clinicians, which I am, as clinicians, our path would have been to say that, okay, a patient had ameloblastoma. Okay, I would remove the tumor, image the tumor, and also image a normal patient. And that will be fine. So normal patient serves as control. And you see the tumor, you take the tumor and you continue with that. That's a conventional way of doing it. But at that particular approach, you may not be able to influence the parameters as much as going molecular and recreating a clinical scenario within the laboratory or at the molecular level in the way we have done. So yes, it's already thanking me. To say for that result, I think it's just fine. We can improve on that with a different study, but this study does not address anything beyond Resolve and EPI. Thank you.
Thank you very much, Professor. from Dr. Uli. Thank you, Professor. You have enriched our insight in usefulness of Resolve and 3D MRI imaging. Great. Okay, Professor Tunde. Dr. Fadil Ulum is a specialist in dental and oromaxillofacial radiology. Also a lecturer in Faculty of Dentistry at Hasanuddin University.
All right.
Thank you very much, Professor. Is there any other participant who'd like to give a question to our professor here? If there's no other question, Professor Tunde, thank you very much. I personally feel that this presentation has given me a lot to think about and to work about because using this kind of technology could save us lots of time in taking diagnostic for the tumor patient. I myself, I'm an oral maxillofacial surgeon, and this will help us a lot. Thank you very much for your contribution. And I would like to close this session and return it to the master of the ceremony. Professor Tunde, thank you very much. You are very great.
Thank you.
Thank you. Thank you, Tunde, for your nice presentation.
Thank you.
Ya, saya kembalikan kepada MC. Silakan.
Thank you very much. That's the lecture from Professor Tunde Bambose. Thank you, Prof, for the information and knowledges. And we would like to welcome Chairperson of 7th Icobtd, Israyani DDS Oral Medicine Specialist, Subspecialist of Infection Consultant in delivering the certificate for Professor Tunde Bambose.
Good afternoon, Prof. Tunde.
Thank you. Good afternoon.
You Prof. Tunde or Prof. Bambose?
Tunde is fine.
Okay, fine. Okay, Prof, we would like to deliver our certificate, NE certificate, of course, as
Thank you.
our gratitude and appreciation to you because today you give us the interesting presentation, of course, of your expectation. And thank you so much for your time and join this event. We hope we can meet in another international conference as soon as possible in great moment and great health condition in the world.
Thank you. Thank you.
Thank you very much, Prof. Tunde.
Thank you. Thank you so much. Thank you.
Thank you so much. And again, we would like to welcome Chairperson of 7th Icobtd, Israyani DDS Oral Medicine Specialist, Specialist of Infection Consultant in delivering the certificate to our moderator, Yosi Yuanita Ariestina, DDS Specialist and Consultant Oral Maxillofacial Surgery.
Okay, thank you, Dr. Yosi, for your contribution. This is your certificate too. Thank you for your
Thank you very much, Dr. Ista.
Leading this session. Thank you very much.
Thank you very much. It's an honor for me.
Once again, thank you to Israyani DDS Oral Medicine Specialist, Subspecialist of Infection Consultant as our Chairperson of 7th Icobtd, Professor Tunde BDS TDS MS FM CDS FWACS, and our moderator Yosi Yuanita Ariestina, DDS Specialist and Consultant Oral and Maxillofacial Surgery. Ladies and gentlemen, that was our session today. But before we end our session today, we will announce for the best question one more time. Here we go. And congratulations for Dr. Nur Hikmah and Dr. Fadlil Ulum Ar-Rahman. And we would like to inform the audiences who got the best questions, to contact our committee at Secretariat of Dentistry Faculty of Hasanuddin University to get the special prize by Polydent. Again, congratulations and thank you for Polydent. For other audiences, don't be sad because we still have our next event. So mark your calendar and set your alarm for our second event on 25th till 27th of March 2022. In the same time, by via Zoom, which agenda is second session and scientific award. So don't miss it and we will meet soon. Remember on 25th to 27th of March 2022. And let's say together, congratulations for Dentistry Faculty Hasanuddin University on the 39th of Dice Natalis in this year. And finally, thanks to audiences that had participated actively and all committee that had worked hard for this event. I'm Rahma. Stay safe and stay healthy. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hey, thank you.
Thank you very
Congratulations
much.
for your
Okay.
academic, Professor Tunde.
Thank you.
Thank you,
All
Tunde.
right. Regards to your wife and
Congratulations
your
for your
daughter.
appointment as a dean there.
Thank you, Irfan. Thank you,
For
Irfan.
information that in our university now, we have a graduate school of oral maxillofacial radiology. So maybe we will invite you as a guest lecturer in our session. Maybe
Thank
soon.
you.
I will contact you by email.
Thank you. Thank you, Irfan. Thank you. Thank you. All right. Have a nice day.
Have a nice day. Thank you.
Thank you. Great presentation. Thank you.
Thank you so much. Thank you so much. Bye bye.
You're welcome.
Bye-bye.
All right then.
Baru Polydent Cleanser, coba sekarang.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser, coba sekarang.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser, coba sekarang.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance. Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser, coba sekarang.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance.
Sensodyne Repair and Protect is a daily toothpaste for the treatment and prevention of dentine hypersensitivity. Sensodyne Repair and Protect contains Novamin, an advanced calcium and phosphate technology. A single Novamin particle ranges from about 5 to 20 micrometers in size. Sensodyne Repair and Protect now contains sodium fluoride, an ingredient that initially posed a problem due to its interaction with Novamin. To prevent this from happening, Sensodyne Repair and Protect also contains adenol, a molecule that coats Novamin and prevents its interaction with sodium fluoride until it is within the mouth. When Novamin comes into contact with saliva, it releases calcium and phosphate ions to build a hydroxyapatite-like layer over and within the dentine tubules. This begins with an ionic exchange between sodium in the Novamin and hydrogen from the saliva. This ionic exchange causes a small localized rise in pH that promotes formation of hydroxyapatite. Novamin particles can bind to collagen fibers in dentine. Once deposited, these particles continue to react and act as a calcium and phosphate reservoir to build a hydroxyapatite-like layer over dentine and within the dentine tubules. This hydroxyapatite-like layer is chemically and structurally similar to biological apatite forming the inorganic portion of dentine. The reparative layer formed by Sensodyne Repair and Protect starts to form after the first brushing and promotes the dynamic mineralization of dentine to build a substantive reparative layer over the dentine and within the tubules, which in turn reduces dentine permeability. Decreased permeability can relieve dentine hypersensitivity by decreasing the fluid flow within tubules, thereby reducing the activity of nerve endings. Sensodyne Repair and Protect delivers clinically proven relief from the pain of dentine hypersensitivity.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser. Coba sekarang.
Redakan ngilu akibat gigi sensitif dengan Sensodyne Repair and Protect. Ini merupakan terobosan yang bagus untuk para penderita gigi sensitif. Sensodyne Repair and Protect dengan teknologi Novamin akan masuk ke tubulus dentin dan membentuk lapisan mineral pelindung baru di permukaan gigi yang rusak. Sensodyne Repair and Protect adalah solusi untuk orang-orang yang mengalami keluhan gigi sensitif agar bebas nikmati makanan dan minuman panas atau dingin. Saya merekomendasikan Sensodyne Repair and Protect yang inovatif.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance.
Sensodyne Repair and Protect is a daily toothpaste for the treatment and prevention of dentine hypersensitivity. Sensodyne Repair and Protect contains Novamin, an advanced calcium and phosphate technology. A single Novamin particle ranges from about 5 to 20 micrometers in size. Sensodyne Repair and Protect now contains sodium fluoride, an ingredient that initially posed a problem due to its interaction with Novamin. To prevent this from happening, Sensodyne Repair and Protect also contains adenol, a molecule that coats Novamin and prevents its interaction with sodium fluoride until it is within the mouth. When Novamin comes into contact with saliva, it releases calcium and phosphate ions to build a hydroxyapatite-like layer over and within the dentine tubules. This begins with an ionic exchange between sodium in the Novamin and hydrogen from the saliva. This ionic exchange causes a small localized rise in pH that promotes formation of hydroxyapatite. Novamin particles can bind to collagen fibers in dentine. Once deposited, these particles continue to react and act as a calcium and phosphate reservoir to build a hydroxyapatite-like layer over dentine and within the dentine tubules. This hydroxyapatite-like layer is chemically and structurally similar to biological apatite forming the inorganic portion of dentine. The reparative layer formed by Sensodyne Repair and Protect starts to form after the first brushing and promotes the dynamic mineralization of dentine to build a substantive reparative layer over the dentine and within the tubules, which in turn reduces dentine permeability. Decreased permeability can relieve dentine hypersensitivity by decreasing the fluid flow within tubules, thereby reducing the activity of nerve endings. Sensodyne Repair and Protect delivers clinically proven relief from the pain of dentine hypersensitivity.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli. Bersihkan dengan cara yang tepat.
Baru Polydent Cleanser dengan kombinasi 4 bahan aktif. Membunuh bakteri 10 kali lebih kuat dibanding pasta gigi. Untuk gigi palsu yang lebih bersih dan segar.
Baru Polydent Cleanser. Coba sekarang.
Redakan ngilu akibat gigi sensitif dengan Sensodyne Repair and Protect. Ini merupakan terobosan yang bagus untuk para penderita gigi sensitif. Sensodyne Repair and Protect dengan teknologi Novamin akan masuk ke tubulus dentin dan membentuk lapisan mineral pelindung baru di permukaan gigi yang rusak. Sensodyne Repair and Protect adalah solusi untuk orang-orang yang mengalami keluhan gigi sensitif agar bebas nikmati makanan dan minuman panas atau dingin. Saya merekomendasikan Sensodyne Repair and Protect yang inovatif.
Polydent cleansers have 4 active ingredients which work in parallel. First, 2 oxidizing agents dissolve to release hydrogen peroxide, helping remove stains and providing a broad antibacterial and antifungal effect. Then, TAED activates, producing paracetic acid and enhancing the antimicrobial action. Last, SLS helps loosen calculus and lower surface tension for a deep clean that breaks apart the plaque matrix. Polydent can help patients keep their dentures clean and maintain dentures' hygienic performance.
Sensodyne Repair and Protect is a daily toothpaste for the treatment and prevention of dentine hypersensitivity. Sensodyne Repair and Protect contains Novamin, an advanced calcium and phosphate technology. A single Novamin particle ranges from about 5 to 20 micrometers in size. Sensodyne Repair and Protect now contains sodium fluoride, an ingredient that initially posed a problem due to its interaction with Novamin. To prevent this from happening, Sensodyne Repair and Protect also contains adenol, a molecule that coats Novamin and prevents its interaction with sodium fluoride until it is within the mouth. When Novamin comes into contact with saliva, it releases calcium and phosphate ions to build a hydroxyapatite-like layer over and within the dentine tubules. This begins with an ionic exchange between sodium in the Novamin and hydrogen from the saliva. This ionic exchange causes a small localized rise in pH that promotes formation of hydroxyapatite. Novamin particles can bind to collagen fibers in dentine. Once deposited, these particles continue to react and act as a calcium and phosphate reservoir to build a hydroxyapatite-like layer over dentine and within the dentine tubules. This hydroxyapatite-like layer is chemically and structurally similar to biological apatite forming the inorganic portion of dentine. The reparative layer formed by Sensodyne Repair and Protect starts to form after the first brushing and promotes the dynamic mineralization of dentine to build a substantive reparative layer over the dentine and within the tubules, which in turn reduces dentine permeability. Decreased permeability can relieve dentine hypersensitivity by decreasing the fluid flow within tubules, thereby reducing the activity of nerve endings. Sensodyne Repair and Protect delivers clinically proven relief from the pain of dentine hypersensitivity.
Hanya merendam gigi palsu di air atau disikat dengan pasta gigi? Cara ini dapat menimbulkan goresan yang menyebabkan pertumbuhan bakteri.
Gigi palsu jauh lebih lembut dari gigi asli.